Welcome to the International Association for Adolescent Health Pioneers Project. In this series, we have interviewed a range of experts from around the world who have led the way in promoting adolescent health in their countries, regions, or internationally. We wanted to listen to their stories and share their experiences so that these might be applied elsewhere. The members of the IAAH Education Committee were particularly interested in how these pioneers influenced the education and training of healthcare professionals in adolescent health. In the following interview, Dr. Mauricio Scarpello is interviewing Dr. Gustavo Girard, a pioneer in adolescent health in South America.
Hello everyone, welcome to this interview for the International Association for Adolescent Health. This interview is very important for me personally. Let me introduce myself for the people that don't know me. My name is Mauricio Scarpello. I'm actually the Vice President for the International Association for Adolescent Health for the region of Latin America. And this interview that I will be doing to Dr. Gustavo Girard, who is next to me right now, is very important for me personally, but it is very important for everyone because of all his history in the field of the adolescent health. So to start, I would like to say hello to...
Hello, Mauricio. How are you?
I'm very, very well, and I'm very happy to be here with Dr. Girard. And I would like to start asking Dr. Girard to introduce himself a little bit so that everyone and all of you know a little bit about him.
Well, since I was very, very young, I said I will be a medical doctor. Well, and that takes reality in 1968, when I received my diploma of my master's of medical doctor. I began as pediatrician. Also, I was not near, but my idea was to be a pediatrician. And that was my job for 10 years, my first 10 years, until 1977. I make my personal work in the hospital of Buenos Aires. It's the hospital of the University of Buenos Aires. Until one day, I went to a conference of a Mexican doctor, Enrique Dulanto Gutierrez from Mexico, about adolescent medicine. And you know, at that moment, it was like something strange. It's like a moment of getting in love with someone. It's like in Argentina, we said, which is belonging from flash, me flasheó. Like a flash. I said, this is my path. This is what I want to do. So immediately, at that moment, we don't have personal computers, nothing near that. Well, searching about adolescent medicine, nothing in Argentina, nothing in all the region, almost nothing. And then I asked Dr. Dulanto if I can go to Mexico, and less than 6 months later, I went to Mexico City, and there I stayed for 3 weeks only. But from 8 o'clock to 5 p.m., I was at the medical center. Indeed, it was an interdisciplinary with psychologists, and I, at that moment, I fell completely in love with the specialty. That was not easy in that moment. And the curious thing is that only 1 year later, or less than 1 year, I began to work in the pediatric area, but only seeing adolescents from 12 to 18, 20 years, but at that moment, early adolescence, between 12 and 15 years. Well, and from that moment I said, well, that was a little bit boring because they were all the little babies and mothers. And so I said, I need a space, a little space. I found an old bathroom that was unused. And at that bathroom, it where I take a reparation of the bathroom and only one and two little chairs. And from that moment, during 9 years, I see more than 4,800 adolescents in 9 years, and with a psychologist first, a social worker later, and at that same moment, in the gynecologist area, Dr. Mendes Rivas began, and Dr. Dr. What's his name? Leticia, I remember, began with the psychological area, and we began to work.
It's very, very interesting, and I imagine that working in a bathroom is not is what it was at that time, what it was possible at that time, and I imagine that it might have been quite difficult to start doing all this in a hospital that is so big and with so many specialities. And about that, I would like you to ask which type of challenges did you have to face in that moment? I mean, to like the recognition of your work, for example, at that time.
That was a real challenge. Not with the people, no, but yes, with the authorities. Why adolescent? Remember, we were at the 1970s. That was a moment very difficult of the politics in Argentina. We have at that moment the military regime, and that was everything that's called adolescent was a little bit suspicious of something strange, no? But what I received was a very great endorsement from people. Oh, so you can assist my boy from 13, my girl that's with his menarche, and all those things that they were absent at that moment. No, and that make me, and when I make the team with the other areas of the hospital, 15 years later, we have a special area for adolescent medicine with, and in one moment, more than 30 people working over there.
And what about at that time? It was like the only place where, at least in Argentina, where adolescent health was starting, or there was any other place in Argentina like trying to make an experience as well?
The first, at that moment, in 3-4 other hospitals, the Children's Hospital and some other places began in similar way, a very similar experience. And at that moment, we met at the Argentine Society of Pediatrics, and we asked to make a committee about adolescent health. After 1 year of asking the authorities of the society, we received the approval. So at that moment, we were, I think that no more than 12 different places, but at the same, almost at the same moment, no? That was very, very interesting. And the thing that's very curious is that only 2 years later, even when I was in the bathroom, I was asked to give conferences about adolescent health. I said, oh, at that moment I was only a pediatrician, very astonished with all the improvements of laboratory findings and something like that. But I began, and 3 years later, I direct a course about adolescent health. And that was very, so you remember we look in the dictionary with you, the self-taught. I am completely a self-taught, but years later I found that something else was necessary.
So that's very interesting because you started as a self-taught knower of adolescent health, like starting by yourself and with all these people that was with you and all the interdisciplinary staff that helps to learn, of course, adolescent health in this time. But I would like to say for the people perhaps that they don't know that Dr. Girard, he was also vice president for the International Association for Adolescent Health, and I would like him to tell us a little bit more about this.
Some years later, Tom Silver, very known, arrived to Buenos Aires, and because of him, I learned that perhaps I must go to the United States. So I went to the United States with a self scholarship, a familiar scholarship, because no one else paid for me. And I went to visit 6 different centers in the East Coast of the United States, especially in the Washington Medical Center, Children's National Medical Center in Washington, and several, Mount Sinai. Also, I went to go to Boston because there was the beginning, the Spirit of Gallagher, and also like this. And that was my first presentation in SAM, the Society for Adolescent Medicine, not health at that moment, Society for Adolescent Medicine. And in SAM, I found an international regional chapter. The international regional chapter was a very few groups of people from, especially from Latin America, but also even from Europe and all those, and Canada especially. And that international regional chapter is every meeting of SAM, we found the people of the international regional chapter. Only 4 years later, I was co-chair of the international regional chapter with Diana Birch from London. No? And that for IAAH was a very interesting thing, because even was much older IAAH from all this history, but at that moment it was very feeble. It was very little group of international Association of Adolescent Health. And we have the meetings of IAAH with the international regional chapter, even at the same time. No, perhaps we have different places for the administrative things, but in all those we were at the same. And there I know Roger Tonkin, that was the moment was the president of IAAH. No?
And about all this history, Dr. Girard helped many other professionals to learn about adolescent health in the country. He's one of the pioneers, of course, of adolescent health in Argentina. And many people learn because of his knowledge. And because of that, I would like you to ask how or when or how it was the way in which you started, like, learning what you have learned to other people, and how did it started to become like a way of multiplying or yes, I think it's multiplying the effect of the knowledge.
With a very curious, there are so many curious things. I was still in the bathroom when I received a letter, at that moment, a letter, nothing more than a letter, from Brazil. We read about your course, your teaching about adolescent health, and we want to go to your center. My center was the bathroom. I said, well, I am just beginning. I made it an answer a little bit, because how can this? No, I want to work with you. Well, if you want to come, I opened my heart and I said, this is open, but I am still learning adolescent. I'm not a teacher. This is not a master, nothing more than that. And that was a doctor from the south part of Brazil, and she stayed with me 4 months. And afterwards, the year later, there were other 2 or 3, even from some parts of Argentina, and that was the beginning. So very, very, I think that only because of the, how you call the youth, the unconsciousness of the youth, to be that, to be learning, because the only other thing that I remember now, it said, I went for 3 months for a center of endocrinology. I said adolescent hormones, endocrinology. Well, I stayed there for 3 months. That was good. But afterwards, I think that the most important thing was in the Italian hospital from Buenos Aires, growth and development. I think that was my beginning. Even, and the other one was all till now. I'm learning.
Oh, you're still we are always still learning about adolescent health. And another thing I would like to come here to talk, it is about that he did not only teach or yes, in Argentina, but also in other countries. And in that way, Dr. Girard, among other professionals, was one of the founders, I don't know if it is the exact word in English, about a big organization, and that here now it's been established, and it's called Confederation of Adolescent and Youth of Ibero-America, Italy, and the Caribbean. It's a very big organization in which I'm actually right now, and we are in a congress right now of CODAJIC, and he is one of the founders. And I would like him to tell us which was if something about this CODAJIC, if it was related to education also, and if he can tell us a little bit more about the organization.
Yes, well, in Argentina, I told you, we met at the Argentine Society of Pediatrics. We found the Committee of Adolescents of this Pediatric Society. And years later, I said, well, we need to have a Latin American Committee of Pediatrics about adolescents. In Latin America, all the pediatric societies are meet in the ALAPE, Latin American Pediatric Association. And so I asked them to meet to make a new committee of adolescents in ALAPE. Well, that lasts for 3 long years. At that moment, I must wrote letters to all the pediatric societies of the continent, asking them to send a delegate for ALAPE. And that at that moment, it was the beginning of the 80s. So that moment was, in the middle of the 80s, the Latin American Pediatric Committee was founded and is still working about now. That was the general idea. And afterwards, even when it was running very well, it was only with pediatricians. We need another general view bigger than that. And I found that in all the world, especially in the region of the Americas, we have the pediatric associations. The regional group is ALAPE, the Latin American Pediatric Association, that it belongs to IPA, International Pediatric Associations. The gynecology group have the societies of gynecology of the countries. In regional of Latin America, it was Alogia, and the other one up in the international one is Fiji. So said, but what happened? We need intersectorial, interdisciplinary groups working with adolescent health. So we began in Buenos Aires making SACIA, Argentine Society of Adolescent Health, Sociedad Argentina de Salud Integral de Adolescents in Spanish. And afterwards we met with Brazil, that they were growing another societies. Mexican was the first one. And I said, well, we must be together. And then said the start of CODAJIC in the 90s.
Well, and that was about CODAJIC. But now I would like you to tell us about what about the IAAH?
Well, I have been going for many years to the United States to the SAM meetings, and there I know everyone from IAAH. And when they know about CODAJIC and about what I was doing, even that was the beginning of CODAJIC at that moment, they said, well, but we need a vice president for South America. So why don't you, at that moment, there were no elections. It was very difficult to say who can be the electors. I said, well, and in conscience also, I said, well, I agree. So I've been vice president from 2001 until 2004, and as no one else wanted to be there, another period for 4 years more, no? And well, at that moment, for me, arriving to IAAH was like, I suppose at that moment, well, that is what I would learn, I want to go. At one moment, I was proposed as president of IAAH at the Kuala Lumpur Congress. At that moment, I think I was a little bit feeble because, they were all English-speaking people. All the Latin Americans was very, very expensive to go to Kuala Lumpur. So even I have a great number of endorsements, even from Europe at that moment. Well, but it was Linda at that moment, the president, and I worked with her with a very good experience.
And with all this experience, all this national and international experience, and being in so many countries and so many conferences, now I would like you to highlight us, like, what would you say to all the professionals that wants to work with adolescent health in terms of training or in education terms? What would you say to the people?
I think I will be, perhaps I am very partial. It's a partial opinion. But for me, working with adolescents, they teach me how to grow, how to change my mind. Today we have had here a meeting about gender, and I told them that since 1990, I'm writing about adolescent males. I have a lot of publications, many perhaps not in the international path, perhaps you will not find them, but about masculinities, the beginning of gender. Well, and I have even 4 periods, it's 10 years. And what I have wrote 10 years before, at that moment, was useless, was impossible to present anymore. So, working with adolescents, making research in adolescent health, that allows me to change myself. No, and now because of that, I am more near than young people than the groups of my age. No, because it's, I think that we don't realize the changing of our societies. They are great, and not changes only to the bad way about the bad press that we have about adolescence, but even the change about how we work, how we something about be more sincere with ourselves, what kind of life we want. It's marvelous. Now here we have adolescent participation in this Congress. They're marvelous. Now we are finishing the Congress and we'll have what the adolescents told us and what are the opinion about the adult world. And that was a great thing. And it meant so many things to done, not only health, but interacting health with education, with public policies. That also is a great challenge for our societies. Not only the learning, no, not only the expertise in adolescent health, but also how to make policies about adolescent health.
I see. And according to all this, what do you think, for example, about mentoring? Because perhaps in many countries in the world, there are people that are starting as you started. Perhaps many people are starting, or they feel that they are alone, or they are trying to build a service or a consultory, differentiated consultory for adolescent health. What would you say to these people that want to start with adolescent health, or like an advice, perhaps?
Let me think. Well, I think that this is one beautiful thing in life is when we found some ideal to make our future, and there are so many things at this group that we call adolescents, young adults, younger societies. So many things to make, so open. So the teaching also must be very dynamic. It must be have a very dynamic way of developing, no? So it will be good for the groups that we work with, but also for us and for our societies. Perhaps the older groups, now our society, our world society is in a great crisis. It's in a very, very big crisis. We have wars that we have not think about in all over the continents, violence, differences, and we must ask what is happening to the world, what is happening as human beings. And at that moment, children and adolescents are the present. They are not the future, as always said. They are the present, and that's very, very exciting. No, and I think that is the most important thing in life. No, and that once I receive a little letter at the end of the year, life is a challenge. This is not a challenge to deal with. It's an adventure. No, and each day have a different thing. We must change. We must, and perhaps the world will be a little bit better.
Thank you very much for your words. I appreciate that. And finishing this interview, I would like one more question. How do you see the future of the adolescent health? How do you see, or how do you imagine it could be the future of the adolescent health?
The future that I think that we have signals in the present, no? For example, my two learning groups, Latin America, North America, and Europe, no? When I went to some meetings, I found there a serious, very important research about research about everything in adolescent health, but even in a very quantitative way. I think that we must change our research. In Latin America, we have the opposite. Nothing very with numbers, but it makes the same thing better for creation, new things. So the mixed, because both things are necessary. No, the quantitative research, the qualitative research, but we have no time at this moment. Very, very several ways that I found, for example, in the bibliography of adolescent health all over the world, that a research, an important research, lasts for 3-4 years about adolescents' behaviors and all those things. And when we present those things, the new generation have changed. It's not the same. No? So both things are necessary. And the pandemic of COVID-19, well, we have tried vaccines without everything out of control. All the controls were not possible, and it was good to make that. But perhaps they suppose, I said, well, perhaps in the United States they think it's a terrible sin what we have made with the vaccines. Well, it's a little bit curious, but when the moment, so we are living evidence-based medicine, and we're moving towards the complexity medicine, medicine of complexity. No, that is the Edgar Morin feeling, thinking. I make a fool with the French, and it's very complex. So even we have the database. I cannot present anything in the United States. I don't have the database. They love the database, no? And it's important, the database, but it's not the only thing. That is what makes my idea about it.
Like the singularity of every adolescent is not just a number. I mean, it's like more than a number. It's very interesting what Dr. Girard said to all of us. And I keep in my mind part of all this history and his knowledge. And he probably has a lot more to tell us, because this is like a short video of something that took many years. And I appreciate this moment that Dr. Girard is sharing with us and telling us about his personal history. And I would like to thank all of you for watching this video. And personally, I want to say thank you very much. And you can go on watching probably other videos with other pioneers in terms of adolescent health. Thank you. Bye-bye.
Thank you.